Knee strengthening exercises for seniors that truly work knee pain. It's something that affects a whole lot of folks, doesn't it? Roughly 1 in 4 adults deals with it. And if you're a senior, that number can often feel even higher. Osteoarthritis, for instance, is the most common joint issue worldwide, and it's a big reason for pain and disability. It's easy to start thinking that an active, joyful life is just a memory. You might believe that hobbling, wincing, and missing out on family fun or your favorite hobbies is just the new normal. But what if I told you that for many of us, it really doesn't have to be this way? What if getting back your mobility and seriously cutting down on that nagging knee pain was more doable than you ever imagined? Imagine this. The grandkids are over, full of energy, wanting to play in the garden, or maybe it's a beautiful morning, perfect for that walk you used to love. But then, that familiar twinge in your knee whispers maybe not today. It's a story so many of us know, isn't it? Knee pain starts to creep in, turning simple joys like walking, climbing stairs, or even just rising from your favorite armchair into daunting tasks. This kind of discomfort doesn't just affect your body. It chips away at your independence, your spirit, and can lead you to become less active. And the real kicker? Moving less often makes knee problems even worse. It's a frustrating cycle, and it's easy to feel trapped. But what if I told you that today could be a turning point? Before we dive into how we can reclaim those joyful movements, I'd love to know where you're joining us from. Let me know in the comments below. What country or city are you watching from? It's always wonderful to see our community stretching across the globe. And if you're looking for more ways to stay active, mobile, and feeling your best, make sure you hit that subscribe button and the notification bell, so you don't miss out on our future videos. Because here's the truly great news. Your body is incredibly resilient. And today, we're going to start fighting back against that knee pain, not with pills or complicated procedures, but with gentle, yet amazingly powerful, strengthening exercises. These aren't about pushing through agony. They're about smartly rebuilding the muscles that support your knees, giving them the stability and shock absorption they need to work better. In this video, I'll guide you, step by step, through exercises designed especially for seniors. Moves that have helped countless people just like you ease pain, improve mobility, and rediscover the simple joy of movement. We'll focus on exercises that are safe, effective, and can be done right in the comfort of your own home, often with just a chair for support. So, if you're ready to take that positive step towards stronger knees and a more active life, you've definitely come to the right place. Understanding why your knees might be hurting before we jump into the exercises, let's chat for a moment about why knee pain is so common as we get a bit older. Our knees are pretty complex joints, you know. They're responsible for carrying our body weight and keeping us stable for almost every move we make. Over time, a few things can start to cause knee discomfort. One of the main reasons is osteoarthritis. This is when the protective cartilage, the cushion at the ends of your bones in the joint, gradually wears down. This can lead to pain, stiffness, and make it harder to move around. Osteoarthritis is actually the top cause of knee pain in older folks. Then there's just the natural wear and tear that comes with age. As we get older, cartilage can thin out, and the structures inside our joints can change. Weaker muscles around the knee also play a pretty big part. If the muscles supporting your knee, like your quadriceps at the front of your thigh and hamstrings at the back, are weak, your knee joint has to take on more stress and impact. That can lead to pain and feeling unstable. Think of these muscles as your knee's personal bodyguards and shock absorbers. When they're strong, they do a great job protecting the joint. Old injuries, even ones from way back, can also pop up again and cause knee problems later in life. And lifestyle factors, like carrying extra weight, can put more strain on your knee joints, making pain worse. Every extra pound you carry adds pressure to your knees. Even wearing unsupportive shoes for a long time can affect how your knees function. The main thing to remember here is that while some of these things are a natural part of aging, serious pain and losing your ability to get around are not something everyone has to accept. And, importantly, strengthening the muscles around your knee can really help with many of these issues by giving better support, stability, and shock absorption, which means less pain and better movement. The power of strengthening, more than just pain relief. So, why is it so important to strengthen these muscles? It's not just about trying to cover up the pain, it's about getting to the root of how your knee joint works. Strong muscles around your knee bring a whole host of benefits that go way beyond just feeling less pain. First off, like we mentioned, strong muscles are like natural shock absorbers. Every time you take a step, your body feels that impact. Strong quadriceps, hamstrings, and calf muscles help soak up this force, taking pressure off the actual knee joint surfaces. This can be a huge help if you have something like arthritis, as it cuts down the stress on cartilage that's already sensitive. Secondly, strong muscles mean better joint stability and balance. Your knees need to be stable so you can walk, turn, and handle uneven ground safely. When those supporting muscles are weak, your knee might feel wobbly or like it's going to give out, and that increases your risk of falls, which is a big worry for seniors. By strengthening these muscles, you're boosting your balance and coordination, which helps prevent falls and the injuries that can come with them. Thirdly, stronger knees mean more mobility and independence. When your knees are sore and weak, your world can really start to shrink. You might find yourself skipping walks, missing out on social events, or even finding simple chores around the house tough. Strengthening exercises can help you get back to these activities, letting you keep your independence and enjoy a fuller, more active life. This isn't just about physical health, it really impacts your quality of life. Plus, doing regular, gentle exercise helps keep your joints flexible and can even help the health of the cartilage you still have. Movement is often the key. It might seem counterintuitive to exercise an aching joint, but the right kind of exercise is often the best non-medication treatment for conditions like osteoarthritis. And research consistently backs this up. Studies show that specific exercise programs can really reduce knee pain, improve how well people can move, and boost the overall quality of life for seniors with knee troubles. So, the exercises we're about to do aren't just wishful thinking. They're based on solid proof of what really works. Safety first. Principles for gentle yet effective exercise. Before we get started with the first exercise, we absolutely have to talk about safety. Our goal here is to make your knees stronger and feel better, not to cause more pain or an injury. So please keep these key ideas in mind during this session and anytime you do these exercises. 1. Chat with your doctor. Asterisk. This is always step number 1 and the most important one. Before you start any new exercise routine, especially if you already have knee pain, arthritis, or other health conditions, please talk to your doctor or a physical therapist. They can help you figure out if these exercises are right for you and might have some personalized advice. 2. Start slow and easy. Asterisk. Don't try to do too much too soon. Begin with just a few repetitions and slowly increase as you feel stronger and more confident. The idea is gentle progress, not pushing yourself until you're exhausted. We're aiming for consistency over doing too much, especially when you're just starting out. 3. Listen to your body. Pain is a stop sign. Asterisk. This one is super important. You might feel a bit of muscle tiredness or a gentle stretching feeling, and that's usually okay. But if you feel any sharp, stabbing, or increasing pain in your knee joint, stop the exercise right away. That old saying, no pain, no gain, definitely does not apply here. We want to work with your body, not against it. 4. Use support when you need it. Asterisk. Many of these exercises can be done holding onto a sturdy chair, a countertop, or even a wall for balance and support. Please use support, especially when you're starting out or if you feel even a little bit unsteady. Making sure you're safe is what matters most. 5. Focus on form, not speed. Asterisk. Do each movement slowly and with control. Good form makes sure you're working the right muscles and not putting extra strain on your joints. It's much better to do fewer repetitions with good technique than a lot of repetitions with sloppy form. 6. Breathe. Asterisk. Don't forget to breathe. Breathe steadily through each exercise. Try inhaling during the easier part of the movement, or when you're getting ready, and exhaling when you're exerting yourself. 7. Warm up and cool down, briefly. Asterisk. Even though these exercises are gentle, a little warm up, like a few minutes of marching slowly in place, can be really helpful. And after your exercises, some gentle stretches can also feel good. We'll build some of this thinking in. 8. Low impact is key. All the exercises we'll be doing are low impact, which means they don't put a lot of pounding stress on your knees. It's best to avoid high impact activities like jumping or deep squats that can make knee pain worse, especially if you're just starting to deal with it. Remember, being consistent is much more important than how intensely you exercise. Doing these gentle exercises regularly will give you far better results than doing a super strenuous workout once in a while. Be patient with yourself and celebrate those small wins. Now, let's get ready to move. Make sure you have a sturdy chair nearby. The gentle yet powerful exercise is all right. Let's begin with our first exercise. Remember to move slowly and thoughtfully, and use your chair for support whenever you need it. Exercise 1. Seated knee extensions. What it is. This is a really great exercise for targeting and strengthening your quadriceps, those big muscles on the front of your thighs. They're major supporters of your knee joint. How to do it. Sit tall in your sturdy chair with your back straight and your feet flat on the floor. Try not to slouch. Slowly extend one leg out in front of you, as straight as you comfortably can, but don't lock your knee. Think about squeezing that thigh muscle. Hold this straightened position for about 3 to 5 seconds. You should feel the muscle at the front of your thigh working. Slowly lower your leg back down to the starting position. Control the movement all the way down. That's 1 repetition. Aim to do about 8 to 10 repetitions on this leg. Then, do the same thing with your other leg. Focus points. Keep the movement smooth and controlled. No jerky motions. Make sure you're not leaning back in the chair. Let your thigh muscle do the work. If you can't straighten your leg all the way, just go as far as feels comfortable for you. Modification. If holding for 3-5 seconds feels like too much at first, start with just a 1-2 second hold and slowly work your way up. The main thing is controlled movement. How did that feel? This is a really foundational exercise, and doing it regularly can make a real difference. Exercise 2. Mini squats, or partial squats. What it is. Squats are fantastic for overall leg strength, working your quadriceps, hamstrings, and glutes. All super important for knee support. We're doing mini, or partial, squats, which are much kinder to the knees than deep squats. How to do it. Stand tall, holding onto the back of your sturdy chair or a countertop for balance. Your feet should be about shoulder width apart, with your toes pointing forward. Keeping your back straight and your chest up, slowly bend your knees and lower your hips just a few inches, like you're about to sit down in a chair that's a little too high. Don't go too deep. Remember, this is a mini squat. Your knees should track over your toes and not cave inwards. Hold this slightly bent position for a second or two. Then, slowly push through your heels to come back up to the starting standing position. Squeeze your glutes, your buttock muscles, as you come up. That's 1 repetition. Aim for 8 to 10 repetitions. Focus points. The key here is controlled movement and not going too deep. Only go as low as feels comfortable and safe for your knees. Make sure your weight is more in your heels than your toes. Gently engage your core, your tummy muscles, to help keep your back straight. Modification. If even a mini squat feels like a bit much, you can simply practice the motion of starting to sit down and then standing back up from your chair, using your hands as little as possible. This is a movement we do every day. Great job! Remember, it's all about the quality of the movement, not how low you can go. Exercise 3. Standing hamstring curls. What it is. This exercise works your hamstrings, which are the muscles on the back of your thighs. Strong hamstrings help balance out the strength of your quadriceps and give stability to the back of your knee. How to do it. Stand tall, holding onto your chair or countertop for support. Your feet should be about hip width apart. Shift your weight slightly onto one leg. With the other leg, slowly bend your knee and bring your heel up towards your backside, as if you're trying to kick yourself gently. Go as far as is comfortable. Hold for a second or two, feeling the muscle on the back of your thigh working. Slowly lower your foot back to the floor. That's 1 repetition. Aim for 8 to 10 repetitions on this leg. Then, switch legs and do it again. Focus points. Try to keep your hips level and your standing knee slightly bent, not locked straight. The movement should come from bending your knee, not from swinging your leg or arching your back. Keep it nice and controlled. Modification. If bringing your heel up high is tricky, just lift it as far as you comfortably can while still feeling that muscle engage. Excellent. You're working muscles that are vital for balanced knee strength. Exercise 4. Heel raises, calf raises, What it is. This exercise strengthens your calf muscles. These muscles are important for supporting your lower leg and ankle, and they even help with balance and knee stability when you're walking. How to do it. Stand tall, holding onto your chair or countertop for support. Your feet should be about hip width apart, with your toes pointing forward. Slowly rise up onto the balls of your feet, lifting your heels as high as you comfortably can. Hold this raised position for a second or two, feeling your calf muscles working. Slowly lower your heels back down to the floor with control. That's 1 repetition. Aim for 10 to 12 repetitions. Focus points. Try to go straight up and down, without letting your ankles roll outwards or inwards. Gently engage your core to help with your balance. Modification. If doing this on both feet is too challenging at first, you can start by doing it while seated in a chair. Simply lift your heels off the floor while keeping the balls of your feet down. Or, if standing is okay but balance is a concern, make sure you have very firm support. Well done. Strong calves actually contribute more to knee health than many people realize. Exercise 5. Side leg raises, standing hip abduction, What it is. This exercise strengthens your hip abductor muscles, which are on the outside of your hips. These muscles are super important for keeping your pelvis stable, for your balance, and for controlling the alignment of your leg, all of which directly affects your knee. Weak hip abductors can sometimes lead to knee pain. How to do it. Stand tall behind or beside your chair, holding on for support. Your feet should be fairly close together. Keeping your leg straight, but not locking the knee, slowly lift one leg out to the side, only as far as is comfortable without leaning your upper body. The movement should come from your hip. Hold for a second or two. You should feel it in your outer hip and thigh. Slowly lower your leg back to the starting position with control. That's 1 repetition. Aim for 8 to 10 repetitions on this side. Then, switch legs and repeat. Focus points. The key here is to keep your torso upright and try not to lean to the opposite side. Keep the movement relatively small and controlled. Don't swing your leg, lift it. Make sure your toes are pointing forward, not up towards the ceiling. Modification. If lifting your leg while standing is too difficult, you can do this exercise lying on your side in bed. Lie on one side with your legs straight and stacked on top of each other. Slowly lift your top leg just a few inches, then lower it. Fantastic. These muscles are often forgotten, but they're so important for stable, healthy knees. Creating your routine and the magic of consistency. So, you've just learned 5 excellent, gentle exercises to start strengthening your knees. Now, how do you actually turn these into a routine that really works for you? The most important word here is consistency. Honestly, doing these exercises for just 10-15 minutes, maybe 2 to 3 times per week, will be so much more beneficial than doing a long, hour-long session only now and then. Your muscles adapt and get stronger with regular, repeated effort. It's a good idea to allow rest days in between your sessions so your muscles can recover and rebuild. For example, you could choose to do them on Monday, Wednesday, and Friday. A good place to start with each exercise might be one set of 8-12 repetitions. As you get stronger and more comfortable, you can gradually increase this. Maybe you move to 2 sets of each exercise, or you could slightly increase the number of repetitions, perhaps going up to 15. Always remember to listen to your body. If you're feeling particularly tired or sore one day, it's perfectly okay to do a little less or even take an extra rest day. Think about how you can fit these exercises into your daily or weekly schedule. Perhaps you could do them in the morning to get your day started, or maybe in the afternoon as a gentle pick-me-up. Find a time that works best for you, and try to stick with it. It's also helpful to remember that progress takes time. You might not feel a huge difference overnight, but with consistent effort over several weeks, you really should start to notice improvements in how your knees feel, your ability to move, and your overall confidence. Make sure to celebrate those small victories, like being able to walk a little further without pain, finding it easier to get out of a chair, or just feeling more stable on your feet. These are all signs that your hard work is paying off. A common mistake people make when they have knee pain is to cut back on activity too much, thinking rest is always the best thing. While really acute injuries do need rest, chronic conditions like osteoarthritis often benefit a lot from the right kind of movement and strengthening. In fact, being inactive can lead to even more muscle weakness and joint stiffness, which can actually make the problem worse. So, by committing to a gentle, regular exercise routine, you are actively taking control of your knee health. Beyond exercises, other helpful activities. While these specific strengthening exercises are fantastic, there are other low-impact activities that can really complement your efforts and give even more benefits for your knee health and overall fitness. Walking. Never underestimate the power of a good walk. Regular walking is an excellent low-impact exercise. It helps maintain joint mobility, improves your circulation, and strengthens your leg muscles without putting too much strain on your knees. Start with short distances and gradually increase as you feel comfortable. And pay attention to your footwear. Good, supportive shoes are really important. Swimming or water aerobics. Exercising in water is incredibly kind to your joints. The buoyancy of the water supports your body weight, which means less stress on your knees, but it still provides resistance for your muscles to work against. Swimming laps or joining a water aerobics class can be a wonderful way to get a full body workout and improve both knee strength and flexibility. Stationary biking. Using a stationary bike, especially a recumbent bike where you're in a more reclined position, can be very gentle on the knees. It allows for a good range of motion in the knee joint without the impact you might get from cycling on the road. Cycling helps strengthen your quadriceps and hamstrings and also improves your cardiovascular health. Just remember to avoid exercises that cause or make your knee pain worse. Things like deep squats, lunges, unless they're modified and completely pain-free, and high-impact activities like running or jumping are best avoided, especially when you're first starting to address knee pain. If climbing stairs bothers your pain, try to limit it when you can, or use handrails for support, while you work on building up your strength. Including a variety of gentle movements in your week, alongside your strengthening exercises, can really make a big difference in how your knees feel and function. You've taken a wonderful step today by learning these exercises and understanding how you can actively improve your knee health. Remember, consistency is your greatest friend on this journey. These simple exercises, when you do them regularly, truly can make a profound difference in strengthening your knees, reducing pain, and helping you live a more active, joyful life. If you found this video helpful, please give it a thumbs up. It really helps other people find this information too. And be sure to subscribe to the channel for more tips, exercises, and advice on staying healthy, active, and strong as you age. I'd love to hear from you. Please leave a comment below. Are you going to try these exercises? Do you have any questions? Or maybe you have your own tips for managing knee pain that you'd like to share with our community. Your experience and insights are so valuable. Living with knee pain can be incredibly tough, often making you feel like you're missing out on some of the best parts of life. But as we've talked about today, you really do have the power to make a positive change. Those feelings of limitation and discomfort don't have to be your permanent reality. By adding these gentle yet powerful strengthening exercises into your routine, you're investing in your mobility, your independence, and your overall quality of life. You are building stronger muscles to support and protect your knees, reducing the strain on your joints, and improving your balance. Remember to be patient and kind to yourself. Progress is a journey, not a race. Celebrate every small improvement, whether it's walking a little further, climbing stairs with a bit more ease, or simply feeling more confident in your movements. Each step forward, no matter how small it seems, is a victory. You are capable of improving your knee health. You are capable of getting back to activities you enjoy. Thank you so much for joining me today and for taking this proactive step towards stronger, healthier knees. Keep moving, stay consistent, and look forward to a more active and fulfilling life. Please remember that the information provided in this video is for educational purposes only and really shouldn't be taken as medical advice. Always consult with your doctor or a qualified healthcare provider before starting any new exercise program, especially if you have any pre-existing health conditions or concerns. They can help you figure out what is safe and appropriate for your individual needs. Stop any exercise that causes pain and seek medical attention if needed.